Welcome to your second lecture in the Certified Fitness Trainer program. We're going to devote this lecture to two important systems, the muscular system and the skeletal system. Movement of the body is contingent on the interaction of these two systems, and they are commonly referred to together as the musculoskeletal system. The combined system consists of bones, joints, connective tissue, and muscles. By itself, the skeletal system consists of bones and connective tissue that help support and protect the body. The average human adult skeleton has 206 bones. There are 80 bones in the axial skeleton, which is made up of the skull, spine, ribs, and sternum. The remaining 126 bones are found in the appendicular skeleton, which consists of the upper and lower extremities, and includes the pelvic and shoulder girdles. There are 5 main categories of bones: flat, short, long, sesamoid, and irregular. Flat bones provide protection and include the ilium, ribs, sternum, clavicle, and scapula. Short bones provide some shock absorption and include carpals and tarsals. Long bones provide structural support and include the tibia, fibula, femur, radius, ulna, and humerus. Sesamoid bones provide protection as well as improve mechanical advantage of musculotendinitis units, such as the knee, and include units in the patella and the flexor tendons of the toe and thumb. Irregular bones serve a variety of purposes in the body, and includes bone throughout the spine, vertebra, as well as the ischium, pubis, and maxilla. A joint is formed when two bones connect and are classified as synarthrodial and diarthrodial. Synarthrodial joints have no separation or articular cavity, such as the joints found in the skull. Diarthrodial joints are freely movable joints with an articular cavity. Diarthrodial joints are classified in 6 categories: arthrodial, condyloidal, inarthrodial, ginglymus, sellar, and trochoidal. Arthrodial joints are also known as gliding joints and are found in the wrist and the foot. Condyloidal joints are ellipsoid joints and can be found in the wrist. Inarthrodial joints, such as the shoulder and hip, are biaxial ball and socket joints. Ginglymus, or uniaxial hinge joints, are found in the elbow, ankle, and knee. The sellar or saddle joint is found in only one place, the thumb. And trochoidal, or pivot joints, are found in the neck and allow us to turn our heads from side to side. Connective tissues, as their name implies, connect different tissues together. In the musculoskeletal system, tendons extend from muscle fibers and connect muscle to bone. They are slightly more elastic than ligaments, but cannot shorten as muscles do. Ligaments connect bone to bone. They maintain some elasticity to allow for joint movement, but this is limited. Cartilage is a firm, elastic, flexible white material. It is found at the ends of ribs, between vertebrae, discs, joint surfaces, and in the nose and ears. The muscular system consists of cardiac muscle in the heart, smooth muscle of the internal organs, and large skeletal muscles that allow us to move. The average human body has approximately 600 muscles that work together with the support of the skeletal system to create motion. We're going to take a closer look at the muscular system and its role in movement. But first, let's cover a few terms that are important when referring to parts of the body. Anatomical position is the most widely used reference point for analyzing the body. In anatomical position, the body is assumed to be standing with feet together, the arms to the side, and the head, eyes, and palms facing forward. Other anatomical terms that you should familiarize yourself with include superior, toward the head, inferior, toward the feet, anterior, toward the front, posterior, toward the back, medial, toward the midline, lateral, toward the side, proximal, closest to the center of the body, distal, furthest from the center of the body, origin, where a muscle originates from on the skeletal system, and insertion, where a muscle inserts on the skeletal system. Muscular anatomy is vital to your practice. Devote concentrated study time to learning the names, locations, origins, and insertions of the muscles in the body. Let's take a look at what a muscle is made of. A muscle is a group of motor units. These motor units consist of a single neuron and all of the muscle fibers innervated by it with the main purpose of contraction. The muscle fiber is composed of myofibrils, which are small bundles of myofilaments. Myofilaments are the elements of the muscle that actually shorten upon contraction. Myofilaments are made up mainly of two types of protein, myosin and actin. There are three main types of muscle fiber found in skeletal muscle. There are a few more that are the subject of current study, but for our purposes, we'll focus on the three main types. Slow-twitch muscle fibers, type 1, are characterized by their slow speed of contraction and high capacity for aerobic glycolysis. These muscle fibers produce a steadier, low-intensity, repetitive contraction, characteristic of endurance activities. Fast-twitch fibers, type 2A and type 2X, contract quickly and are used most in strength, power, and speed activities, such as weightlifting and sprinting. Skeletal muscle contraction occurs when the brain sends out an electrical signal that travels through the spinal cord to the spinal nerves and on to the motor neurons. These neurons send an electrical current through the muscle fiber, resulting in muscle contraction. When a muscle fiber is stimulated by the motor neuron, the electrical signal triggers the release of calcium, which binds to actin. This permits actin to interact with myosin. ATP provides the energy that permits the sliding of myosin across the actin. This pooling results in the shortening of the muscle fiber known as muscle contraction. When we contract a muscle, however, the number of fibers that actually contract is dependent on the activity. However, fibers do not partially contract. Once a muscle fiber has been stimulated to contract, the all or none theory states that a unit is either completely relaxed or fully contracted. Another theory that governs muscle contraction is the size principle. This principle states that motor units are recruited in order according to their recruitment thresholds and firing rates. Lower threshold units, like type 1 fibers, are recruited for low-intensity activities, such as picking up a fork. For lifting a 75-pound dumbbell, the type 1 and the larger type 2 fibers may be recruited. Resistance exercise, like strength training, results in contractile protein adaptations, such as muscular hypertrophy. Hypertrophy refers to the increase in size of the muscle fiber and is the accepted cause of muscle size increase. Hyperplasia of the muscle fibers would indicate an increase in the number of muscle fibers and not the size. The idea that hyperplasia may be responsible for muscle size increase is an unresolved topic of scientific debate. Cardiovascular exercise results in mitochondrial and capillary capacity adaptations. Mitochondria are the powerhouse of the cell, and through a series of chemical reactions, produce ATP from glycogen. Increasing the number and size of mitochondria in the cells increases the amount of energy available to the muscle fibers. Increasing capillary capacity increases the potential for gas and nutrient exchange in the muscle fibers. In other words, more oxygen and nutrients can be delivered, and more carbon dioxide and waste products can be carried away. The body works in harmony, and every system is vital to growth and development. The tissues of the neuromuscular system, from the brain to the tendons and ligaments, produce movement. The brain controls and initiates the message. The central and peripheral nervous systems deliver the message. The muscles produce the force. And the connective tissues, particularly the tendons, regulate it. Teach the brain to ask for more, and it will. Allow the nervous system to deliver more, and it will. Demand the muscles to produce more, and they will. Finally, ask the tendons and ligaments to allow more, and they will. Of course, it will take an integrated approach to training, and we'll cover it all soon.